Hi guys, again. So this is my second take because I have to re-upload a new video because the first video uh, was very high resolution and it would take uh, a lot of hours to yes. So again, for this video we will talk about chemotherapy. So uh, I know perhaps some of you have the idea what is chemotherapy, but for some who still have the lack of understanding what is chemotherapy, then allow me myself to introduce what is chemotherapy. So chemotherapy is basically an aggressive form of chemical drug therapy meant to destroy uh, rapidly growing cells uh, apart from the normal body cells. So it is usually done to treat cancer, as cancer cells rapidly grow and divide faster than the normal cells. So there are basically purposes why we opt for chemotherapy. One is to lower down the total number of cancer cells found in the body. So that's one purpose. Another purpose is that to reduce the chances of cancer spreading or metastasis, we say. And then the third purpose is to shrink the tumor size, and the last is to reduce current symptoms of cancers. So those are our purposes why we opt for chemotherapy. Now, talking about the goal of chemotherapy in cancer patients, or in cancer treatment, there are three main identified goals why we choose chemotherapy for cancer treatment. One is one is as a cure. So in some cases, the for uh, treatment of chemotherapy as a cure can destroy cancer cells to the point that the doctor can no longer detect the cancer cells in the body. So after that, the best outcome is that they never grow back again. But that doesn't always happen. So that's why in some cases, patients are still advised to take some anti-neoplastic drugs or other drugs uh, that can hinder the growth of the tumors, just to ensure they will never grow back again. So again, another goal of chemotherapy for cancer treatment is to control the spread of the cancer cancer. So or metastasis in medical term for cancer spreading, and then ease of symptoms. There are instances where chemotherapy cannot cure cancer or prevent the spread of cancer. So uh, chemotherapy is done to relieve the signs and symptoms uh, of the cancer or the tumor. So what they do is to shrink the size of the tumor that causes pain or pressure. So these tumors often continue to grow back. So uh, despite the effort, it's still to continue to grow back. But again, we still at least we try to relieve some of this pain that our patient is feeling. So going back again, let's summarize this information. The goal of chemotherapy process is to kill cancer cells or to slow cancer cells growth over time. So the use of chemical agents or drugs that are selectively toxic to malignant cells and tissues. So the final goal is to stop or slow down the growth of cancer cells. So those are goals and purposes of chemotherapy. Now, talking about nursing diagnosis for chemotherapy, one is we have risk for infection related to immunosuppression or immunosuppressive effects of the therapy. So, another nursing diagnosis, risk for infection related to the lack of understanding about proper infection control measure. So, it is important to inform our patient or to educate the patient about the risk of possible infections because uh, they are fragile, they are susceptible in acquiring infections. So it is important to equip them with the right knowledge and understanding, as well as to prepare them for possible infection. So it is really important that uh, uh, understanding about possible infections. So moving on, there are special consideration that as nurses must take into consideration. So one, uh, again, chemotherapy is a strong, powerful medicine that can harm and destroy the cells. So it is must be handled safely and carefully disposed. So healthcare staff may be wear gloves, a mask, protective goggles, or gown to avoid direct contact with the medications or the drugs. Some drugs describes as a vesicant, so because they control the term uh, they can cause damage to the skin. So I just forgot the term. So once they damage the skins, once they leak out from the veins. So a member of the healthcare team may stay with the patient when the drugs are given. Since chemotherapy can weaken the immune system of our patient, it is important that as a healthcare professionals, we all we must be reminded of hand hygiene, wash our hands often so that we can raise the possible transmission of infection to our patient who is already immunocompromised. Next is practice food safety, and then yes, that was mentioned earlier about protecting ourselves from the harmful chemical. Moving on to our those are just our special considerations. So moving on to our nursing responsibilities before the procedure, it is important to explain about the procedure to our patient. We can allot time for inquiries or cater some questions and then answer those questions so that our patient will be cooperative during the conduct of the procedure. We must provide patient privacy to our patient, and then teach the patient on how the procedure is done. It was mentioned already. And then a number of medical tests are done before chemotherapy before started. The oncologist will determine how the cancer spread from the results of x-rays and other imaging tests from other samples of tumor taken during the surgery or biopsy. So, as nurses, it is important to review the chemotherapy drugs prescribed for the patient to take. One is the name of the anti-neoplastic agent. Next is the dosage, the route of administration, and the date and time each agent to be administered. So, next responsibilities is which is basically practice in our college is to accurately identify the client by using two identifiers. One is to uh, ask the patient by its name and identify the patient's name through the name tag. So medications to be administered in conjunction with the chemotherapy, such as antiemetics and sedatives, may be also prescribed to the patient. And then assess the client's conditions, including most recent blood studies, blood counts, including hemoglobin, hematocrit, white blood cells, and platelet count. So most presence of complicating conditions which could contraindicate chemotherapeutic agent administration, such as infection, severe stomatitis, decrease deep tendon reflexes, or bleeding may may hinder the effect of chemotherapy. And then to assess our patient's physical status, level of anxiety, and then their psychological status as well. Moving on, during the procedure, it is important to prepare measures when administering chemotherapy. We use gloves, and then the mentioned PPEs during the discuss of special considerations. Uh, the mask, protective goggles, gloves, and then gowns. So the another is another responsibilities during the procedure is use lower lock fittings on IV tubings used in delivering chemotherapy. And then observe the 10 rights of medication administration. Then after the procedure, moving on to after the procedure, it is important to dispose all equipments used in chemotherapy preparations and administration, excuse me, designated containers. In their designated containers, dispose all chemotherapy waste as a hazardous materials. Monitor client for signs and symptoms of anaphylactic reactions, such as urticaria, pruritus, sensation of lumps in the throats, shortness of breath. Assess it for electrolyte imbalances, and then teach uh, the client and the family to report excessive fluid loss or gain, change in level of consciousness, increased weakness or ataxia, paresthesia, seizure, persistent headache, muscle cramps or twitching, nausea, and vomiting. So those are some of the effects of the chemicals or the drugs that the patient is being taken. So it is important to take note of those signs and symptoms. So prevent another role is to prevent extravasation or of vesicant drugs, uh, drugs. It is important to implement measures to treat extravasations of vesicants medications if it occurs. Now, another is to teach our client to increase fluid intake to 2,500 to 3,000 ml per day unless it is contraindicated. Uh, Last thing to consider after the procedure is to assess uh, and check for bone marrow depression if there is a decrease in white blood cells and red blood cells, uh, granulocytes, and platelet counts. So those are just the things that I would like to share about chemotherapy. So if you have something, questions or queries about chemotherapy, I will gladly to answer those questions through private messages. So thank you for listening. So bye.